facilitating today's. So what we're going to do is we are going to start off with a presentation, and then we will have some time at the end for question and answer. But do feel free to add your Q&As into the Q&A board, or actually just into the chat if you're more comfortable with doing that. And we will get around to answering that towards the end of the session. Just a little bit of housekeeping. Please do make sure that you keep your microphone on mute during the presentation. And yeah, let's get started. Oh, also just to say, we are trialing our French captioning. Unfortunately, we don't have a live translation available for this webinar, but we are going to try this, and we hope that it is actually suitable for all of you. So thank you very much. Right, so the last mile distribution of family planning and reproductive health commodities is an essential, critical, but often actually very challenging step in the supply chain. But it is essential for ensuring that women have access to those commodities when, where, and for as long as they actually need them, empowering them to be able to plan their families and their futures more effectively. So we're very pleased to be able to welcome Rado Ratsima from the CHMP RAME consortium. He's going to be telling you about the work that they have been doing in Burkina Faso that really helps to address some of the challenges that we find and aiming to improve access to those family planning commodities at the last mile. So, Rado, can I hand the floor over to you?
Hello, Linda. Hello, everyone. Thank you so much for giving me the floor. May I share my screen?
Yeah, please go ahead.
Okay. Can you see my screen?
Yes, we can, but it is in presentation mode.
Okay. Let me just... Okay, is it better now?
Yeah, that's a whole lot better.
Yes.
Thanks, Rado.
Okay. Yes. Okay, perfect. Okay. Yeah, so hi again, everyone. My name is Rado Ratsima. I am a project manager of the Decision Support Systems Challenge in Burkina Faso. And I work for the CHMP RAME team. Prior to starting the presentation, I wish to thank the Digital Square team, the financial partner of this project, for giving us this opportunity to present the key achievements of our project. As you know, and as you probably read through the invitation card, the project theme is empowering women and girls through data-driven last-mile access to contraceptives. This theme is so important for us because it highlights the three key aspects of the project. So firstly, data-driven decision-making, last-mile access to contraceptives, and last but not least, women empowerment. To begin, let me introduce you the context of the project. Family planning is a human right. And it is crucial to underline that since the beginning, family planning is a human right. It has been officialized during the International Conference on Population and Development that all couples and individuals have a basic right to decide freely and responsibly the number and spacing of their children and to have information, education, and means to do so. Now, in order to ensure that every person all over the world can fulfill their family planning right, we need to unleash collective genius because each of us has something to offer. That's what Linda Hill, a business administration professor at Harvard the Business School, said. We need to unleash collective genius because each of us has something to offer. Sharing the same conviction, the CHMP RAME consortium sat together to ask a fundamental question. What then can we offer? If each of us has something to offer, what then can we offer? What can we offer to ensure universal access to sexual and reproductive healthcare services? What can we offer to guarantee that everyone achieves their human right to family planning? What can we offer to advance women's empowerment? And what can we offer to reduce poverty and achieve sustainable development? In order to respond to this question, we consulted the UNFPA's family planning prioritization report. From the report, we identified 2 priorities to improve access to family planning and reduce unmet need in Burkina Faso. One of the priority was commodity security. The report says Burkina Faso was prioritized under commodity security. Efforts should be made to improve the contraceptive logistics and supply system in order to improve contraceptive security at all levels of the healthcare system. The other priority, which is equally important, is high subnational disparity. The report says family planning programming should consider the subnational variations in unmet need and work to reduce barriers faced by women in underserved regions. After identifying these key priorities, it became clearer to us that what we can offer in order to advance the human right for family planning is our contribution to improving the last mile access to contraceptives and other essential health commodities for women and girls in Burkina Faso. And to achieve that, we need good decision-making. The UNDP talks about inclusive and responsive decision-making in the SDG, suggesting that inclusive and responsive decision-making promotes sustainable development. The USAID Global Health Supply Chain Program follows through by emphasizing that better decision-making cannot be achieved without better data quality. Better data quality, better decision-making. That's why we have decided to respond to the Digital Square's invitation and apply to become part of the Decision Support Systems Challenge, the DSSC. Now, let me talk a little bit about our project. Our objective is to contribute to improving the last mile access to contraceptives and other essential health commodities in Burkina Faso. The project has been implemented for 10 months. It has been implemented in the Yako District in Burkina Faso. The project leader is the Centre Humanitaire des Métiers de la Pharmacie, the CHMP. The implementing partner is the Réseau d'accès aux Medicaments Essentiels, the RAME. And the financial partner is the Digital Square. Now, our implementation strategy is based on user centricity. We have used a user-centric approach throughout the project. Why? Because we know that the relevance of our interventions depends on end users. if our intervention does not respond to the end users' 4Ps, that is, their perspectives, their priorities, their preferences, and their patterns, our interventions are irrelevant. Relevance depends on the users. There is also an African proverb which says that the blind person among their own knows every path. In French, l'aveugle qui se trouve parmi les siens n'ignore aucun chemin. As project managers, we realize that we are blind without the guidance of our project beneficiaries. In this context, the beneficiaries are the family planning end users. So we need their guidance in order to know where to go. That's why the participative approach has been used throughout the project, and this approach is based on user centricity. Our user-centric approach has been rolled out across 2 project phases. Phase 1 consisted of the development of a mobile application. I will tell you more about this later, but this mobile application is called the SSC Collect, and a design thinking-based process was used to develop this app. Phase 2 was a data collection campaign, which enabled to identify the key issues faced by contraceptive users regarding the last mile access to contraceptives in the Yako District, which is the project zone in Burkina Faso. The DSSC Collect app is a mobile app that collects data on end users' perceptions of the availability and quality of family planning products and services in the Yako District. It features 4 key functionalities. A survey questionnaire. It is important to underline that we value inclusion in our project. That is why there is a written survey questionnaire, which is in French, and there is an audio version of the survey questionnaire, which is in the local language in Mure. So that even if people don't know how to read, even if people don't understand French, they can still give their opinions on the availability and the quality of the products and services. A digital library of family planning articles. It's important for us to ensure that the women and girls get the right information about family planning. We discovered recently that in one of the departments where we are working in the KIRSI department, misinformation about family planning is being spread. So it's important for us to fight for misinformation with our digital library of articles about family planning. A discussion forum. The discussion forum is very interesting because it enables women and girls to share their experiences about family planning and reproductive health and create community-based support networks, encouraging them to pursue good family planning habits to make the world a better place, one community at a time. And there is also a menstrual cycle tracker within the app. The menstrual cycle tracker is the Cycle Beds app, and it promotes natural contraception by helping women to manage fertility and plan or prevent pregnancy. The menstrual cycle tracker is particularly popular actually among the end users. I will just discuss quickly about the design thinking based development process we used. So this process had 4 key steps. Firstly, exploration. The exploration was about interviewing end users about what are their needs, what are their technological needs with regard to the last mile access to contraceptives. So we asked the end users first, because for us, end users always come first. Ideation is about bringing now together all the family planning actors, including healthcare professionals, international organizations, civil society. So all the stakeholders were grouped together in order to design a solution. What technology should we develop based on the needs of the end users? Co-creation now is about going back to the end user, because we start with the end user and we need to end with the end user as well. Co-creation is about bringing a prototype of the application to them so that they can give us an idea of what we can improve. And finally, implementation now is about improving the application based on the on the advice of the end users on the recommendations, and additionally giving them training to use the application and then deploying the application for it to be used. The data collection campaign, it enabled to evaluate the functionality of the DSSC Collect mobile app and address any detected issues in order to ensure seamless user experience. It also enabled to identify the issues faced by end users regarding the last mile access to contraceptives. We believe that the problem is the solution. That is why it's important for us to identify issues faced by end users so that we can formulate recommendations, ensuring that vital services are within everyone's reach. A cluster sampling method was used in order to design to identify and design the sample, and 514 end users participated in the data collection campaign throughout the project. Now, here are some key results of the data collection campaign. 30% of end users did not have access to their preferred family planning and reproductive health product. This is highly concerning because the UNFPA's 3.0 vision aims to achieve zero unmet need for family planning by 2030. However, we can see that considerable efforts are required in order to achieve that, particularly if we talk about the Yako District. Implants lead as the most frequently out-of-stock contraceptive option, with a notable 56% shortage rate, followed by injectables and pills. When their preferred contraceptive was unavailable at their regular health center, patients turned to private pharmacies. They opted for a recommended alternative. Sometimes they also scheduled a return visit, or they sought solutions at another public health center. Now, more alarmingly, 7% of the patients abandoned their quest for their preferred contraceptive when faced with stockouts at their usual health centers. The waiting time, we discovered it, stands out as the leading cause of dissatisfaction in reproductive healthcare services. More than half of the patients paid for family planning and reproductive healthcare services. This is quite interesting because normally contraceptives should be free of charge at public health centers in Burkina Faso. It's actually, if we refer to the law, contraceptives should be free of charge at public health centers. However, we discovered 12 public health centers who charged for family planning and reproductive health products and or services. So now the question is, were these products, were they charging these products within the framework of the law, or is it an illegal practice? So that's why this data was quite interesting. Now, atypically, a statistically significant positive correlation was observed between the length of contraceptive use and fertility rate. Normally, we would expect that proper and constant use of contraceptives would help to better plan pregnancies and reduce fertility rate. But here, we discovered an opposite trend, which is the longer they use contraceptives, the higher the fertility rate. So it poses another question, which is, are contraceptives being properly used? And finally, another alarming result is that we discovered a high rate of teenage pregnancy. Now, based on these key results, we could define the key issues when it comes to the last mile access to contraceptives in the Yako district. So there are 5 key issues identified. Firstly, as we just discussed about now, high rate of teenage pregnancy. Secondly, 30% unmet need for family planning, excessive waiting times. There is a possible illegal billings of reproductive healthcare services, which raise concerns. And the last key issue that we identified is a potential improper use of contraceptive methods. In order to respond to these key issues, we used a 2-pronged approach. The first prong is about the Inclusive Innovation Task Force. We set up an inclusive innovation task force involving contraceptive users, healthcare professionals, and civil society to develop relevant approach to address the key issues related to the last mile access to contraceptives in the Yako district. In the future phase of the project, we aim to involve health authorities and government actors as well within this task force, so that we could benefit from their support to trigger change. The second prong is the monthly co-creation workshop. So the monthly co-creation workshop was implemented to gather all members of the innovation task force to have a look at the data collected from the end users, then collaboratively identify key last mile access issues from those data, and formulate recommendations to address the issues. So these were the 2-pronged approach. This was the 2-pronged approach we used to address the issues identified. Now, based on this approach, we have formulated recommendations for the next phases of the project. And the recommendations aim to address the identified issues. So now I would like to present to you a table where we can match the key issues and the recommendation which we thought would align with them. So we recommend the creation of a data visualization platform. That means a platform ensuring real-time data access at all levels in order to respond to the issue of the 30% unmet need for family planning. Because we believe that if health actors and health authorities can access real-time data, it will promote inclusive and responsive decision-making. It will promote as well a quicker decision-making in order to resolve the issue of unmet need. A centralized platform for collaboration could also be created in order to engage different health actors at all levels, from the community health workers to the health authorities. They could work together in order to address any contraceptive shortage issue occurring in the Yako district. So, and the centralized platform could help as well to share the good practices, so that there is cross-fertilization among different actors, and everyone can work together hand in hand in order to promote a better last mile access for contraceptives. A social impact platform tailored for age inclusive awareness could be implemented in order to respond to the high rate of teenage pregnancy. What we mean is we could implement a sensitization platform which delivers messages based on the user's age. For example, for teenagers, the message, the sensitization delivered could be related to child pregnancy. For young adults, we could, this platform could provide advice on how to capitalize on family planning in order to better plan their career. So we are thinking about implementing a social impact platform which is really tailored for different women and girls of different ages in order to make sure that the message they receive is really appropriate with their life and with their needs. And in order to address the issues of the excessive waiting times and the potential improper use of contraceptive methods, an e-health platform could be developed to allow for virtual consultations, because so that the women not have to go to the health centers, wait at the health centers, and face long waiting time. So e-health platform can help with a virtual consultation so that they can, it can be more fluid. They can discuss with their healthcare providers in a more fluid way. And especially when, especially during the consultations, when they don't have to go to the health centers, because there are sometimes routine consultations during which the patients don't really have to go to the health centers, but they can communicate with their healthcare providers at a distance. So virtual consultations can help to cater for those needs. Follow-ups also are important, because we have identified that there could be an improper use of contraceptive methods. So it's important for the healthcare providers and the patients to be able to communicate at different times, and to promote a follow-up of whether the patients, for example, should renew their contraceptive method, or maybe certain types of actions should be made in order to enhance the effectiveness of the methods. Counseling sessions could also be promoted, because patients do not know necessarily everything about family planning. So it's important that they can have this closeness with their doctors, with their healthcare provider. They need to be close to them in order to easily receive advice and easily make decisions. And it can also help with digital appointment booking in order to reduce waiting time at the health centers. Finally, as we discussed about, there could be a possible illegal billings of reproductive health care services. This could be addressed through a digital whistleblower system, through which end users could be encouraged to communicate any possible issue of illegal billing of family planning products or services, and then the authorities should be able to know about these issues and also act on them. So now, before going to the conclusion, I think it could be pertinent, because I'm sorry, we should have done it in the previous slide, but before going to the conclusion, it could be more pertinent if I can invite my colleague Jacques to do a little demo of the DSSC Collect application, so that the participants who don't know the application yet can discover it and also have a better understanding of what the application does. So may I ask Jacques to...
Yeah,
Keep
yeah,
it
yeah.
going.
Thank you, Ado. Thank you,
Okay, let me
everyone.
just stop sharing.
Yeah, do you listen to me, please?
Yes, yeah.
Hi, hello.
I
Could you
can hear
listen to
you.
me? Yeah, okay. Thank you. So, as I said, it's a pleasure to present you a little demo, just to revisit and remind what Rado just said. So, first of all, just let me remind you that the project has two components. The one is the data visualization portals for agent, and the other one is the apps, the DSS collect apps for beneficiary, for patients. So beneficiaries use the following application to respond to the survey. As you can see, there are several menu, but the main use is about the survey, the first menu, which help us to respond to the survey launched by the agent in the about the delivery product access. So with this manner, the servers, some servers are in audio format or writing version. So those people who doesn't understand who could not read text can listen to the audio and respond to the server. Yeah, I have to notice that as part of this, there are other menus available to provide information about good practices and help them to control their menstrual cycle. The menstrual cycle functionality has not been developed by our own, but is rules by your first apps which we add to the main app. Just please, Hado, can you stop your screen sharing if it's still on?
Okay, let me check. I think it's off, Jacques. I'm not sharing anymore.
Okay, thank you. So as I'm doing that, this is how we download a forms, a survey, and trying to respond to. And during the training and during this period, when we use the apps to collect data, women have been training for using the apps, and we made some workshop about it just to help her to help her to rules and manage the application as they can do. And the other side of this application is the data visualization dashboard, which helps agent to visualize data collected and just to visualize the metric, the metric collected, and in order to interpret the result linked to the survey, as Rado just said. By example, we have the as indicator, we have the busiest center, the product available, the most or less available product. And I have to notice you that sensitive data has been anonymized to protect women's information. So as I'm showing you on the screen, this is a survey. We are just replying to one, and we can notice the audio button just on right in the corner. Just to help those people who can read the test, and it's a kind of accessibility. apps accessibility for women. So at the end of the survey, we can save it for later send. Why? Because we notice that in this environment, remember that we can have internet troubleshooting. So just to avoid those time we can have access to internet, we can save data on local apps, and after sending when we are ready. Okay, so by the other side, please, Flora, may you stop your screen sharing, please? I'll start sharing the data visualization dashboard. Okay, so as I'm saying from the data visualization, thank you, Flora. So on Kobo Collect, we got could you see my screen sharing? Yeah. So we get a portal for the dashboard where we can find tricks about those collected data. And if I select one by default, I can get that where I can have information about data collected, and by analyzing them, I can have all the data collected and the visualization information report. So the BI has been included in that data visualization, and all of us, we agree about those key we have to report on the dashboard. So that's the second part of this project. So thanks you. I won't be too long on this demo. This is just a little demo, but we have more functionality about it, but I won't stay long. So thank you for your attention, and thank you, Rado, for this sharing. Let's continue, please.
Thank you so much, Jacques, for the demo. Okay, so in conclusion, the DSSC in Burkina Faso contributes to improving the last mile access to contraceptives and other essential health commodities for women and girls. A user-centric approach is used to implement the project, and the project key achievements are listed as follows. Firstly, through the project, we could create the DSSC Collect mobile app that Jacques just presented. We could collect data from a representative sample of 514 contraceptive users in the Yako District. We could identify key last mile access issues based on user perceptions. As we said, we really do believe that relevance depends on the users, and also it adds up to different digital health projects occurring in Burkina Faso. And finally, we have established an inclusive innovation task force who meets every month in order to formulate recommendations to be able to improve the last mile access to contraceptives in Burkina Faso. Thank you very much for your kind attention. And if you have any question, it will be really our pleasure to have a chance to answer them. Thank you.
Hey, thank you very much, Rado, and Jacques too, for your live demo. Always a bit nerve-wracking doing that, but it was great to actually see the app in action. So thank you very much for that. Rado, we do have a couple of questions in the chat, which I'll read out for everybody. One about some of the data that you found, and then another one about the design process. But the first one from Kevin is, could you talk more about that positive relationship that you found between length of using contraceptives and pregnancy? So things like, how many women were included in this analysis? Who were they? Was it only women currently using contraceptives? Could it include people who'd been using contraception for a long time but had stopped because they intended to have another child? Can you give us a little bit of your thoughts around that data?
Okay, yeah, thank you so much, Linda, for this question, and thank you so much, Kevin. Yes, okay, so the length of using contraceptives and the fertility rate, effectively, it was an interesting finding. It was very interesting to discover that the longer the users made use of contraceptives, the higher the fertility rate was. And in terms of the number of people involved, all the respondents during the data collection campaign during phase 2. So it is more precisely 372 women were involved in this data collection. And yes, it included different women actually. So we actually divided, we classified the women in different age groups. So yeah, so there are teenagers, there are 20 to 24 years old, there are 25 years old and above age groups. And it involved all women in these groups. It involved women also who do not necessarily use contraceptives consistently. Like some of them used, as you said, some of them used contraceptive at a certain point in their life. They could have stopped and then they resumed the use of contraceptive again. So in order to make a short answer, it involved all the women who replied to the survey during the second phase of the project. Yes, and as the women are based in a remote area, it could be possible that they might not have enough knowledge about the importance of contraceptive, when to use it, how to use it. So it could have contributed to the fact that the longer they used it and the higher the fertility rate. It's also important to add that we discovered that the older the users were, the higher their fertility rate, and also the older the users were, the longer they have used contraceptives. So personally, I think that the fertility rate and the use of contraceptive are much more related to age. Older women used it for a longer time. Older women had more children as well. But interestingly, there was no negative relationship between length of use and fertility rate. So I think the thing is really based on age. It's just that the older the woman, the more children they had. I think that's the main aspect of our one main aspect of our finding. And and then in terms of length of use, I really think that there is some issue in the district about the knowledge on how to really make an effective use of contraceptives.
Right, thanks for that, Rado. And one more question, this time from Yanari. So this was more about the app. Did you have any challenges when translating the app content into the local language?
Yes, yeah, we had. Thank you so much for the question. Yes, actually, as we know, it's not it's never easy to innovate, and through this translation process, we really tried to promote an innovation. You know, we really tried to ensure that everyone can respond to the questionnaire. So yeah, we faced some issues. One of issues, for example, and I would like to share the floor also with my colleagues at RAME. But I just want to say quickly that one of the issues we faced was we did multiple trials in terms of translating the app, because our initial trials failed. We failed because there was a time, for example, when we did not consider the accent. We considered that you know, this is More, this is the local language, so we need a translator who can speak More. But when we went back to the end users and presented them the audio version, they told us, you know, thank you so much for the translation, but we don't really get it because we don't speak with that accent. So we had to try again, and yeah, it was not a straightforward process, but we are very glad we've been through it, and it's mostly a discovery learning, actually, with a trial and error. Now I would like to, yeah, I don't know if my colleagues at RAM could give more explanation on the translation process.
Hi, there's someone from RAM on the call who might be able to give a little bit more detail?
Bonsoir Ado, bonsoir à tous. Je pense que Wally et Bado sont dans la salle. Ils pourront donner plus d'éclaircissements sur les difficultés liées à cette intégration de la transcription. Merci. Thank you.
Great, thank you. Yeah, and thanks very much for sharing that, Rado, because I thought it was a great learning. You know, one of the very good features of this particular app is that accessible feature of having audio prompts for people who are not able to read the content. But those are the sort of things that do trip up, and it's important to be able to share that as part of the design process. So thank you for that. There is one more question as well, this time from Katie. Were mobile phones provided for the study, or could the app handle multiple users for a shared device?
Yeah, thank you so much. Thanks a lot for the question. Mobile phone was not provided, actually, but it's impressive, you know, how many women have mobile phones nowadays, especially Android phones. It's highly impressive. So yeah, we didn't provide mobile phones, but many of the users did have mobile phones, and for those who did not have mobile phones, we provided them with support. What I mean is, the collectors helped them to fill in the questionnaire through the collectors' devices. So we had, firstly, we trained data collectors, we trained them, and then they went out in the field and they approached the contraceptive users. They introduced them about the app. If they had mobile phones, they helped the women to download the app with their mobile phones. If the women did not have mobile phones, the data collectors helped them to insert data about last mile access inside within the collector's device.
Great, thanks very much, Rado. Rano, there's just one other thing that I thought might be interesting just to share with the participants, and that's the questionnaire for the stock managers, because we've seen a lot around the questionnaire for the end users, for the beneficiaries, but can you maybe just touch on that questionnaire used by the stock managers at the various facilities?
Oh, yes, of course. Yeah, thank you so much for your question. Yes, actually, yes, I focused a lot on the end users questionnaire, it's true. Yes, but indeed, we have developed a questionnaire for stock managers as well. And the reason is we find it important to be able to compare the data from the end users and the data from the stock managers, so that we can really identify where the problem lies when it comes to the last mile access to contraceptives. So yes, indeed, we developed a questionnaire for stock managers, and we developed them with the stock managers themselves. I remember it was a trial and error process as well, because we developed a lengthy questionnaire at the beginning, and when we brought it, we organized a brainstorming session with stock managers. We told them, we did some research, we read different reports about last mile access to contraceptives, and we drafted this questionnaire that we could fill in at least each month in order to better understand how is the availability of contraceptive at your health center. So yeah, so we developed it, we brought it to the stock managers, and they provided their inputs, because they are the ones who know the situation on the field, because we can do desktop research and we can discuss with different professionals, but it's only the people on the field who can really understand the situation and provide a better advice on how to refine the questionnaire. So we brought it to them, and finally we came up with a more compact questionnaire, which is much more comfortable to fill in, especially if you have to do it every month, because we understood now that with the work that they have to do, it's not always it can get complex actually for them to fill in a lengthy questionnaire every time. So we have learned really from that, and now we could develop a more appropriate questionnaire for them, and it is web-based actually, so that is an important information as well. At the moment, it's not yet included within the application, but we really do hope that in the future phases, we can integrate the stock managers questionnaire inside the TSSC Collect app. I think it will make it much more easier to visualize the data, and also to analyze the data, and even to compare them.
Thank you so much, Rado. Sorry, I've just seen there is actually another question in the chat from Dr. Soma, a doctor at one of the private clinics in Yako District. So glad you could join us as well. So this is a question for the partner. So I believe that's intended for RAME. What does the partner intend to do to take account of some of the recommendations made? And also there is a request about supporting private health centers with reproductive products. Is there someone on the call who can answer that? Rado, is something that you could take a stab at?
Sorry. Yeah. So, okay. Sorry. Okay. Sorry. Could you repeat the question, please? I didn't really catch it.
Sure. Sorry. It's so the question is, what do you intend to do to take account of all the recommendations that were made through this particular project? And then the request is really about supporting private health centers with free reproductive products. That might be a question for a longer discussion. But do you want to maybe just tell us more about, what happens next with the recommendations?
Okay, okay, yeah, thank you so much, Linda, and thank you so much, Dr. Sama. Dr. Sama was highly active actually throughout the project. He is part of the innovation task force who met with us every month. And yeah, in terms of the recommendations, at this point, we are now drafting technical proposal for the next phase of the project. We have advanced on it with our IT team, and we have started meeting different possible partners as well. For example, we just recently had a meeting with Digital Square branch in Burkina Faso. So yeah, so right now it's really about being able to synthesize the recommendations, design a solid project proposal around it, and also liaising with the key technical and financial partners who could collaborate with us in order to implement it and make sure that the project keeps going and it is sustainable.
Great, thank you so much. And I see we're actually just over time, so it just leaves to me to wrap it up. And to do that, I want to say a very big thank you to you, Rado, and to Jacques as well. Thank you also to Amadou for joining, and Dr. Soma as well. Thank you for sharing your learnings and the app with us. And just to say to anyone, if you do have any sort of follow-up questions or you want to know more, please, you can reach out to the team via Digital Square if that's easier. Otherwise, you can contact Rado. And also to note, we will be sending out a link to the recordings and the slides and the contact details following this webinar. So thank you very much, everybody.
Thank you so much, Linda.
Thank you, Linda.
Thank you, everyone. Thank you so much, Linda.